Okay, good morning, everybody. Thank you for being with us today. My name is Joe Philippek. I'm the Continuing Education Manager here at Reaching Across the Illinois Library System. In a few minutes, I'll be turning things over to Sarah Troll, who's the Population Health Coordinator for the DuPage County Health Department. Just a couple of reminders before we get started. Today's webinar is being recorded, so if you have colleagues who would benefit from the content of today's webinar, they would have the opportunity to view an archived version of this, which usually is ready about a week or so after the webinar airs. And also, feel free to use your chat box on the right-hand side to ask any questions you might have. And as time permits, we'll relay those to Sarah, and she'll get through as many as we can. So I think with that, Sarah, I will turn things over to you.
All right. Thank you so much, Joe. Hi, everyone. I'm happy to be here today and share with you Impact DuPage. So Impact DuPage is a new collective impact initiative here in DuPage County around assessment and planning and community action. So what I'd like to do is just give you some background about how that started and what we've done so far, and then really spend the second half of the presentation going through our new website, which is an exciting resource. I'm glad to share that with you today. So first, just some general background, the vision of Impact DuPage and what we're trying to do. Impact DuPage is committed to creating a common understanding of community needs, gaps, and priorities that will advance the well-being of the DuPage County community. And a lot of what that's based on is really data. So using data to inform our decisions, get a picture for what our community looks like, and use it continually, as we're trying to address issues, and see if things are working and what we need to adjust, really do like a quality improvement loop. So this is just kind of an idea of what we're trying to do, advance the well-being of our community. So when our community partners got together about 1.5 years ago to begin Impact DuPage, really kind of start that idea, they came up with 5 goals for our initiative. The first one is to increase the visibility of community needs. So as I mentioned, that's really with an emphasis on data, looking at the different issues in our community and raising that level of visibility so that we can address them all together. The second goal is to anticipate and manage change through centralized data collection and analysis. So this is really trying to avoid being, reactionary to problems, looking at how our community is changing, what issues are facing them, using this, data that we have available, community voice, and then develop our strategies from there, really trying to be proactive about what we're doing. The third goal is to engage the community and create broad multi-sectoral ownership for issues impacting DuPage County residents. So as you'll see later, the priorities we're working on, we have 5 issues, things like mental health, housing, substance abuse. These are really complex issues. They aren't things that, really one organization can tackle alone. So this is where we're looking for, different groups, hospitals, the educational system, libraries, businesses, all of our different sectors to work together, because we're all touching our community in different ways and really, having this collective approach to these issues. The fourth goal for Impact DuPage is to leverage local funding to strategically and collaboratively address our priorities. So this is really looking at aligning all of our resources, taking advantage of the funding that's available, not duplicating our efforts, so keeping in mind that there are some fiscal challenges right now. So that's where that goal really comes from. And then the 5th goal is to inform and define the legislative agenda. So as we're increasing the visibility of these community needs, really making our decision makers aware of that, having this information readily available to them so that we can use it to make our policy decisions. And based on those goals, I can kind of take you through this process, that really how Impact DuPage got started. So in August 2013, we had community partners from different sectors, many of them health and human service sectors, so different social service providers and hospitals, the health department, the DuPage County Community Services, all of them coming together and looking at, the state fiscal crises that were going on, the increased demand for human services, the changing healthcare landscape with the Affordable Care Act. How can we all work together, really align what we're doing and not work in silos, really communicate and tackle these complex issues. So that's how they all kind of came together in August 2013. And they spent the next several months really developing that vision. What is it that we want to do together? And what does that look like? So that vision I talked about on the first slide about advancing the well-being, they developed that in the first few months of this initiative. And then in June of 2014, so about a year ago, that's when we began our assessment. So, we want to work together to advance the well-being of our community, but, what do these issues facing our community look like? What is the picture of our community? What are the quality of life issues that residents want us to focus on? That's really the purpose of that assessment. So we completed, 4 components of our assessment between June and December of 2014. And I'll go more in detail into those in the next slide so you can see how we came up with our priority areas. So after those assessments were completed, our steering committee reviewed all of that information and really saw 5 issues kind of bubble up to the top, which were mental health, substance abuse, affordable housing, access to health services, and healthy lifestyles. And I'll go more into our questions or our kind of context for those issues later on, but those are what they saw out of the assessment phase. So now that we've determined those are the issues that we want to work on in our community, we're looking at how, who's already working on these things in our community, and how can we connect them with other groups, bridge any gaps that are happening, and develop a strong action plan to really kind of move the needle or improve the well-being of our community. And that's what's been happening basically since February, and will be going on the rest of this year, really making those connections, developing those plans with the goal of next January 2016 of kind of launching all those plans. And then also in February, we launched our dashboard website, which is what I'm going to spend kind of the majority of the presentation on. And that's really highlighting those data that we use and making that data available to the community to help them in their work, and then kind of keeping us in check as we're going along. How are we doing? Are these issues improving? And do we need to adjust our strategies moving forward? So that's what our process has looked like over the past, I guess, almost 2 years now. So as I mentioned, in June of 2014, we started an assessment. So that was really to determine what does our community look like, what issues are facing our residents. And so there were 4 different ways we went about that, because we didn't want to just look at these hard numbers or kind of look at things in isolation. And we used an evidence-based process called MAP to do this. So the first part of our assessment is called Forces of Change, and that's really asking some of our leaders to get together and brainstorm what things are facing our community. So things like the changing healthcare landscape, things like income disparities in our communities, an increase in technology in recent years. So we're seeing easier ways to communicate with different people in the community, but also maybe an increase in screen time, and what repercussions does that have for the health of our community. Misuse of prescription medications, an aging population, which can lead to some isolation for older adults, or some income barriers with the older adults, and things to keep in mind with that population. Resource scarcity or climate change, and then also kind of the criminalization around mental health and substance abuse, and how that stigma might make it difficult for treatment for those issues. So those are kind of the more qualitative and abstract concepts that we wanted to keep in mind as we were doing our assessment. So that's that forces of change, those events, forces that we're seeing in the community. The second part of our assessment was called the landscape review, and that's really asking residents what is happening in your community. What do you think we should be focusing on? Because that's definitely an important voice for this assessment. So as you can see on this slide, it has a picture of the flyer that we developed that kind of summarizes those results. We did a community survey. We had over 2,000 responses from residents. And it asked things like, what are the greatest strengths of DuPage County? So you can see here the top three were, good schools, low crime, safe neighborhoods, parks and recreation. And then we also asked, what do you think are the three most important health concerns in DuPage? So, alcohol, drug abuse, mental health problems, and obesity, overweight. And then where should DuPage County focus its attention to make things better? So good jobs, healthy economy, affordable housing, access to mental health treatment. So we really want to keep this in mind. This is what people are seeing in their community as we determined what our priorities are. The next piece of the assessment was called the local system assessment, and that was really our community providers coming together in this day-long meeting and saying, how is our system doing, our social service provider system? How are we doing at diagnosing and investigating, health problems? How are we doing at enforcing laws? How are we doing at linking people to needed services in our community? And where do we have some difficulties? So maybe we're doing a good job with emergency communication, but some groups don't know what's happening. So maybe there needs to be more communication about that. So that assessment really told us that we could do more work with partnerships in our community and with research in kind of public health and workforce development. And lastly, we did a community profile, and that's really all those kind of hard numbers about the picture of quality of life in our community. So things like quality of life, behavioral risk factors, so substance abuse, and the number of fruits and vegetables that people report that they're eating, environmental health, maternal and child health, so low birth weights and breastfeeding rates, chronic conditions, death, injury, and violence, all of those different kinds of quantitative data that we wanted to keep in mind as well as we're looking at all of these different issues. And the next slide here just shows a snapshot of some of the demographic hard numbers that we looked at, because we've been going through kind of a demographic shift in DuPage County and really wanting to keep that in mind as we're developing services and looking at where our needs are. So you can see on this slide some different things that have been happening, different population increases. The over 55 and over 85 age groups have increased, while the age 25 to 34 age group has decreased. Our foreign-born population increased by 24% when the overall population increased by 3%. Different communities in our western boundary of the county have increased significantly in population recently. And then also looking at what our populations in poverty look like. So 10% of children under 5 in DuPage are living below the poverty level. So wanting to have a good idea of what our community looks like and who really might need some support and services as we're moving forward. So all of these different pieces of our assessments really helped us get these 5 priority areas. So as I mentioned before, affordable housing, so really looking at how we can inspire community action to develop housing that meets our needs in this county. Mental health, how do we strengthen the mental health treatment system to respond to the complexity of mental health issues? Access to health services, how do we capitalize on these changes within the healthcare landscape to support diverse populations? Substance abuse, how do we strengthen prevention and treatment of substance abuse issues in DuPage? And then healthy lifestyles, so really looking at how can we influence positive choices or partners and residents to make positive choices regarding nutrition, physical activity, and the built environment. So the built environment being things like different parks and fast food restaurant density and farmers markets and all of those kind of man-made parts of our environment that can help us, bike paths, things like that. So that's just kind of some background about what we've been doing as an initiative, really wanting to use that data, get the picture of our community, develop goals and strategies, which is what we're doing now, and then inspire community action. And our website helps us do that in a couple different ways, and we also want it to be really a helpful tool for our entire community. So I'll go and give you kind of a tour of the website now. Okay. So this is the homepage of the website. It's impactdupage.org, and we just launched this in late February. And I really see this as being helpful to libraries in a few ways, and I think that'll be more clear as we go through it, but there's really a wealth of data about DuPage County on here, which I'm hoping will be helpful in answering patrons' questions, be it students or just residents who are looking for more information about the county. Also for use in writing any grants that you have, it really gives a picture of the demographics of our community or what our needs are, or developing services and getting a picture of what our community looks like. So on the home page we have those 5 priority areas that I just spoke about, our vision as well, that we're working to advance the well-being of the DuPage County community. A graphic about our process, so really looking at it's not just facts, but they don't tell the whole story, even though they're important, but that voices, such as when we did that community survey and we had that day-long meeting with partners, really helped round out our assessment of our community, and that all of that leads to this plan for community well-being. We also have a video here. We had applied for the Robert Wood Johnson Culture of Health Prize, and this was part of our application for the second round. And this is really just a small snapshot of some of our collaborative efforts in DuPage. So I think that's worth checking out. It really highlights some nice efforts that we have going on. And then here at the bottom, if you're interested in signing up for our mailing list, we do monthly e-newsletters. You can click on this link here. And as of recently, we've been highlighting different features of the website. So that's helpful for kind of bringing out new tools that you may not have seen before. And then as we're developing these goals and strategies moving forward, you'll have more updates about that, what we're really doing to address these priorities. So with that, I'll move up and go right to the data. So the community dashboard, kind of the central location for the data on the website. And I'm just going to scroll through so you have an idea of the kinds of things that you can look for and see on here. There's many indicators related to health, access to health services, different cancer incidence rates. And then as you'll see over here, there's a gauge. And we'll go more in depth into one of the indicators in a little bit, but this just shows you quickly kind of where we fall. In this case, it's in comparison to U.S. counties in this first one. So when we fall in the top 50% of U.S. counties, which is why the needle is pointing over to the green area. If we were in the bottom quartile, it would point to the red, and then in between, of course, it would point to the yellow. So just a quick look at how we're doing in those areas. So access to care, cancer, county health rankings, that's a group of rankings run by Robert Wood Johnson Foundation, so we've pulled in some of their rankings here. Diabetes, disabilities. When the gauge is in blue, that means it's neutral. It's neither good nor bad. It's just showing kind of a comparison. Exercise, nutrition and weight, family planning, heart disease and stroke. Immunizations, vaccinations, different infectious diseases, maternal, fetal, and infant health, mental health and mental disorders, older adults and aging, oral health, other chronic diseases, respiratory diseases, wellness and lifestyle. So as you can see, there's a lot of indicators related to health, but then we go into these other categories as well. So the economy, so you can see different things related to employment. So sometimes when we're not comparing to different counties and we're just comparing to ourselves in a prior year, then it's just an arrow going up or down. And if it's neutral, again, it's blue. And if it's good, then it's green. So indicators related to housing, homelessness, income, and poverty. Then we also have indicators related to education and the environment, both air, the built environment, water, toxic chemicals. Then voter turnout, really kind of showing community engagement under government and politics. Public safety, so different crime rates, alcohol-impaired driving deaths. Our social environment, family structure, community attachment, and then finally transportation. So there's over 100 indicators here on different data points in DuPage County. We worked with a vendor, Healthy Communities Institute, and they maintain the majority of these data indicators. There's a handful that we've uploaded ourselves that I maintain, but otherwise the vendor maintains them, which allows us to keep this large amount of data up to date all the time. So when the data kind of refreshes from the source, be it the census or the Illinois Department of Public Health, they update it very soon afterwards so that we can know that we have the most up-to-date data on the site. So with that, I'm going to go and show you one specific indicator so you can see what kind of information is available. I'm just going to click on babies with low birth weight as an example. So underneath the indicator, you can see what this indicator is, and this is showing the percentage of births in DuPage County in which the newborn weighed less than 2,500 grams, and that's considered low birth weight. So as you can see, that's 7.4% of births here in DuPage. We're in the top 50% of counties for that compared to just other Illinois counties. You can see where the data came from the Illinois Department of Public Health, and if you want to kind of get more information about that data, you can click the link. You can see when it was last updated, which is in February. If you scroll down here, there's just a little bit of information about why it's important, what kind of things you can see with low birth weight that would make us want to be aware of it and aware of its prevalence in our community. You can also see what's been happening over time. So there was no change between 2010 and 2011, and then you can see what the previous years were as well. See if we're improving or if we're staying relatively the same for a particular indicator. And then if an indicator has a corresponding Healthy People 2020 target, which are national benchmarks set by the Centers for Disease Control and Prevention, then that target is listed here, and it will also show whether we've met it. So we're below, or we've met the Healthy People 2020 target for this particular indicator. And then on the side, you can see some related content. So if you're looking at this indicator, maybe you'd be interested in some of these others, preterm births, teen births. There's also promising practices. So I can show you that as well in a few minutes, but there's a database here on the website of, it's a national database maintained by the vendor of different programs throughout the country that have different kind of levels of evidence. There's evidence-based practices, there are effective practices, and then good ideas, all things that have been working in different communities. So if you're looking to address a particular area, be it prenatal care around something like low birth weight, or if it's obesity, you can look at what's been working for other communities and then get in touch with that community and say, how did you do this? What are some challenges you've been seeing? And really wanting to share all of these successes, so we're not, reinventing the wheel and taking advantage of good information out there. And then community resources. So these are kind of resources related to this indicator, local in DuPage. So if you're looking for, local resources about baby food or pregnancy, and where can you find that for someone in DuPage, that's, you can click on some of these links here. Another feature of the dashboard is our disparities dashboard. So where an indicator can be stratified by age or by gender or race and ethnicity, they've pulled all those indicators here. So you can kind of see how we're doing by different groups. So just looking at this first example, adults with health insurance. You can see by age, they're all pretty similar, but there is a dip in this 25 to 34 age group. And then if you scroll down here and you look at adults with health insurance by race and ethnicity, you can see that Hispanic or Latino adults have lower rates of health insurance than white or non-Hispanic adults or Asian adults. So helpful in letting us see how different populations of our community might be disproportionately affected by different issues, which can help us with our strategies. Who do we need to really specifically reach out to and help? There's also a demographics section, and that's just quick facts about DuPage County, really related to population. This pulls in right from the census. This is really something I find more helpful for doing things like preparing grant applications, where you just kind of need that community picture kind of intro about, what does our population look like. It also has, the land mass for DuPage and things like that. Now, by location type or topic, so you can see some of these indicators by zip code or census tract, which can be helpful when you're working, more specifically at your municipality level rather than the county level or in neighborhoods. So I'll just do that as an example. I'll do 60187 here. And now it's showing me all the indicators that I can look at that are specific to that zip code level. So I'm going to scroll down. And I'm just going to look at this linguistic isolation indicator. So linguistic isolation shows the percentage of households in which every member age 14 or older has some difficulty speaking English. That can lead to some isolation or barrier speaking services, so we want to know, how is that affecting our different communities. So when I scroll down now, you can see the map is all divided by zip code, and we're looking at 60187, which is 3% of households in this zip code have some difficulty speaking English. And if you click the map, then we scroll down, so we can see the 3% right there for 60187, and we can click different zip codes. So 60137 is 3.2%, 60101 is 14%, 60563 3%. So you can look at your particular municipality or neighborhood and really see what are the different data points for your community. The next section on here is local reports. So that is really compiling all of the kind of county-wide reports that we have in one spot. So, our hospitals do a needs assessment every 3 years for an IRS requirement. So we have those assessments here. We have a hunger study for DuPage County that was prepared for the Northern Illinois Food Bank, the DuPage Narcan Program annual report. So different places to find are different reports here that you can find all in one place. Our Illinois Youth Survey results for DuPage County. And then finally under data we have our impact DuPage assessment. So those are those 4 pieces that I was mentioning earlier during the PowerPoint. And this is where you can click each of these links, hyperlinks to the report. So you can get much more detailed information about what the results were and our process for each of these assessments. And then here at the bottom we also have a link to a survey that we just keep open. So if you've been looking through this and you think, you know, there's some suggestions about how we could do this process better, or a different kind of quality of life issue that you didn't see represented, or something like that, we would love to hear your thoughts because we want to continually improve this process. So there, as you can see, there's a wealth of kind of that data information on our website. So then if you move to the next tab, Tools, that's really how can we take this data and kind of look at it in different ways. So the first is the Healthy People 2020 tracker. As I mentioned, if there's a Healthy People 2020 benchmark, you can see the comparison and how we're doing compared to that benchmark. So that just pulls all of them into the one place right here. The Socio Needs Index is something that was designed by our vendor, and it takes zip codes from across the country and looks at different socioeconomic characteristics of that zip code, and then gives it a score from 0 to 100, with 100 being the highest need. And then it colored our highest need zip codes in a dark color. So it's just kind of an interesting way to look at our community and kind of a nice starting point of what areas of our county you know, might have some of our most vulnerable residents, or need some additional support. Promising Practices, as I mentioned, that's this database for different programs for you know, different kind of subject areas. So you can search in here, you know, something like obesity or prenatal care, or different substance abuse, different programs, and see what people have been doing, what's been working for different communities across the country. Funding opportunities, this pulls in national funding opportunities from different foundations and different government sources, so that you can kind of peruse that and see if, you know, you're looking to fund a project in a particular area. This would be a good starting place to then kind of take you to their request for proposals and be able to submit that application. And then these 2 things here, Indicator Comparison Report and Report Assistant, are just ways to kind of look at indicators next to each other. So if I want to look at the number of adolescents in DuPage who were overweight or obese, and then I want to look at that next to our number of recreational opportunities or farmers markets or something like that, I could pull in those indicators and look at them side by side. So there's a large amount of data, there's tools to look at it different ways, and then we also wanted a place where people could see what's being done in the community, or what are some action steps that they could kind of take with that information. So first is our community resources section. So this pulls in directly from the DuPage CRIS, C-R-I-S, which is the Community Resource Information System. And it's run by the county, and it's similar to like a 211 kind of information directory. And it has a large variety of programs from across the county, and so you can click on whatever you happen to be looking for. You know, the school health program, or, you know, workplace resources, and you can click that. It will take you to the CRIS, and you can see, you know, the contact information or hours or phone numbers for the different locations or services in DuPage. Community coalitions. So there are different coalitions already working on a lot of these complex issues in our county. So we wanted a spot where we could, you know, link to their website if they have one, provide contact information. So if you wanted to reach out and say, you know, I'm interested in working on this issue, or, you know, how are you guys doing it? Can I be a part of it? Really wanting to raise the level of awareness of all work that's happening in our county. So you can see, there's the Forward Coalition, which focuses on healthy lifestyles. There's the Technical Advisory Group focuses on infectious diseases. Interfaith Mental Health Coalition works with faith communities to do education about mental health, mental illnesses. A variety of different coalitions that are working on substance abuse, some kind of at the municipal level, and then others just countywide or about specific substances. Different kind of specific municipalities, Grow Healthy Villa Park, We Go Together for Kids is in West Chicago. The DuPage Funders Collaborative, DuPage Continuum of Care focuses on homelessness, railroad safety, the Latino Service Providers Network, the Bensonville Community Youth Services Coalition, and then the DuPage Youth Services Coalition. And then lastly, we have countywide initiatives. And those are just kind of broad campaigns that are countywide working on some of these different issues. So 54321 focuses on healthy lifestyle. Enroll DuPage is around the Affordable Care Act and helping people enroll in either Medicaid or the health insurance marketplace. DuPage Narcan program, the Glenbard Parent Series, which offers programs that are available even to people outside the Glenbard district. So we're highlighting these coalitions and initiatives so that people know about them or they can get involved, but we recognize that in addition to these and the data, we may not have everything on the site already. So we wanted a spot where people can go to let us know about data that you might have or be aware of. You were looking for something in particular, it's not on here, but maybe that's something we can consider adding to the website in the future. If you have a great program that works in your community, you can submit that to the Promising Practices database and really share it with other communities. If there's a coalition you're on that's not on the list, you can submit that as well. Or if there's a particular community partner that's doing great work and you want to spotlight them, we'd love to use this as a way to really highlight great work that's being done. So these are all ways you can click on these and send us an email and really let us know, because we want this to be as helpful to the community as possible. So if there's ways that we can improve it, we really want you to share that. So finally, the last tab up here is about us, our history and vision, and kind of more detail about how this all kind of came to be. Our Impact DuPage partners, which is a list of all of our steering committee members and their different organizations, as well as the other groups that have partnered with us here at the bottom, particularly with getting the survey out to different communities. And this list is just growing as we develop strategies for the new for these different priorities, and we're working with these different groups. I also wanted to share this partner toolkit. So this is different things that our Impact DuPage partners can post on their websites to really share the word about the website, but they might also be helpful to you at your library or organization as well. So you can host a mini dashboard if there's a particular area that you're interested in that your organization focuses on, or is a program, or it can pull at random from any of the indicators, and it just looks like this, and you can embed it on your website. So it's a nice way to show kind of the status of those areas if it's something that you're focusing on or working on. For something more general, we have the Impact DuPage widget that different partners have been posting on their site. I know also in kind of a useful link section, we've had a couple libraries have the website there, just kind of listed as text or a hyperlink. And then finally, the Impact DuPage flyer, which looks like this, we have available in English and Spanish. So if you're going to a community meeting about this and you want to just have some quick notes about what Impact DuPage was, or you want to share it with someone or email it, that PDF is available here. And then another spot to sign up for our newsletter if you're looking to do that. The final tabs under About Us are Impact DuPage Priorities, which is on our homepage. So I already kind of went into those 5 areas here, just reinforcing that it's related to these different assessments if you're interested in more information about those. And then finally, our Contact Us section. So you can send us an email, you can fill out this form. Either way, we end up getting the information. So if there's questions you have about the site or suggestions, it's very easy to kind of get that to us. And as I'm going back to the homepage, I'll also note that we do have the Google Translate ability to translate the site to, I believe, Spanish, Chinese, and Polish. So there's some limitations with, of course, Google Translate, but it's available if that's something that you're looking to share with someone that has kind of language limitations with English. So that brings us back to the homepage. I know that was a lot of information. There's just a wealth of data on the site. So I'm happy to take any questions that you have now, as well as if you think of any later. If you're going through the site and you can't quite remember something you saw during the webinar and can't find it, don't struggle. Just send me an email or give me a call or something, and I'd be happy to walk you through it.
Okay, so, well, first of all, thank you, Sarah. A lot of good information and information we can use not only with our patrons, but as we work on things like strategic plans and making sure that our services really match some of the needs in our community. And obviously, you got a lot of data here that can be used for that. So great resource. Remind everybody, if you have any questions now on your mind, you can use that box on your right-hand side to ask Sarah a question. But if not, I will be sending out a follow-up email. And Sarah said I can include her email, so feel free to send her any questions that you might have on your mind. And as I said, we recorded this, so we will hope to be able to get that out in the next week or so. So I don't see any questions coming in, so I think, Sarah, you covered everything perfectly, so nobody has any questions. But if you do, as I said, feel free to send an email to Sarah. So I guess with that, we will just wrap things up. Sarah, thank you again for coming out and doing this webinar for us. And to those of you that joined us, thank you for being part of today's webinar. And enjoy the rest of your day.